I have actually come to the conclusion that nursing is hard everywhere, but there are some places that nursing is sweet, and anesthetic nursing is one of them. Beautiful people, welcome back to another video. In today's video, I'm going to be sharing with you my experience in the theater. Well, if you know me very well, you know that I do not like the theater. Right from when I was in school of nursing, I dread going to the theater. I dread seeing CS. I dread everything that has to do with the operating room, right? As someone who loves adventure, I'm like, well, you haven't really seen how the operating room is in the UK, and it's not really a nice thing not to have experienced how it is, since I did not even school here. And I'm like, okay, I'm gonna give it a go and see. I am a medical nurse and I work in the cardiology unit. I do love adventures. If you know me very well, I love trying new things. Well, the only new things I do not try is food, because of my stomach. I have a very sensitive stomach, so I don't really like trying new food. And of course, my man, I don't like trying new men, if it makes sense.
You get it? If you don't get it, forget about it.
I have had the shifts in radiology. I've had the shifts in AMU. I've gone to ED, that's the emergency room as well. And I have been to the respiratory ward, the acute respiratory ward. One place I want to try again is endoscopy, but I've not had like an opportunity to go there. So yeah, I went to the theaters today, and this is what happened. At the end of this video, you will have an insight of what anesthetic nurses actually do. I'll also give you an idea on how you could become an anesthetic nurse if you are intending to practice here in the UK. If this is something you'll be interested in, why not you clicked on this video? So definitely you will be interested in anesthetic nursing, or just like me sharing my experience. Please stick to the end of this video, and you'll be wondering, am I going to move? Am I going to leave cardiology for anesthetic nursing? I will let you know at the end of this video, so please stick to the end. If you are seeing my face for the first time, thank you so much. It's Dale here, and I am your captain. If you are a returning subscriber, thank you so much for coming back. I do appreciate it. Anesthetic nurses are registered nurses that are trained to look after patients that are going to have anesthesia. They help them before, during, and after surgeries, or when they need to be put to sleep. So they can work in the theater, they can work in ICU, they can also work in emergency room where a patient needs expert care in airway management. So basically, the job of an anesthetic nurse is from the airway. So we're taking note of ABC, most especially A. So their job is basically in the theater, as I did today, put the patient ready, put the patient to sleep, help the patient stay alive during the whole procedure, and bring them back to life when the procedure is done. Sounds like something interesting, right? I thought so too. So let's get into how my day went. I had the opportunity of shadowing a nurse working in an anesthetic room today. The shift starts at 8 o'clock. They do have about 3 different shifts you can work. The first one runs from 8 to 6, and you have the one that runs from 9 to 8, and some of them do 8 to 8:30. So it depends on the surgery, or depends on where exactly you will be working. Basically, you go and meet the charge nurse to tell you where exactly you will be working on that day. When you have gotten your assignment, you have to change into your scrub, because you're not allowed to wear your own scrub, or you're not allowed to like wear scrubs from home. They do have scrubs that are there. Put on your scrub, change your crocs, your shoes. So we had about 7 patients that were due for surgery today. We only had one of them that needed a spinal anesthesia. The rest of them had general anesthesia. Make sure that the anesthetic machine is set up. Turn on the anesthetic machine and check. Make sure it all has pass. If it doesn't have pass, we need to make sure that whatever having fault is being fixed before any of the surgery commence. Emergency drugs are in. We know we need to intubate and extubate the patient. The airways, all the ambu bags, everything is in check, and making sure that there is no leakage. All the checks done and they're happy to get the patient, so we go get the patient. We had something called the safety briefing, where we just talk about all the cases we have lined up for the day. We had the scrub nurse, we had the circulating nurse, we had the surgeon, we had anesthetics, and we had the nurse anesthetics. After debriefing and knowing the patients, myself and the anesthetic nurse, we went to the med room. So med room is like where the patient waits. It's just like a recovery room where the patient waits to be taken to the theater, and also where they go back to after they have done the surgery, where they recover before going back home or going to the ward, depending on how severe their case is. So what we do when we get to the med rooms, we confirm the patient's name, date of birth, and first line of address. We also confirm the hospital number, making sure we are taking the right patient, and just the normal ID checks. Make sure the patient knows the surgery the patient is going for. Also, when the patient confirms the surgery and you confirm that that's actually the surgery the patient is having, the patient needs to now confirm that they have signed the consent form and basically ask them, is this your signature? And the patient says yes, and say, okay, fine, are you happy for us to go ahead with your surgery? The patient says yes. Then we escort the patient from the med rooms down to the theater. So whilst going, I realized that the nurse I was working with, she was asking them always, she always asks all of them this question. She asked them, oh, okay, so if you are not going to be having a surgery today, what will you be doing? And I feel that's really nice, kind of like a diversional therapy. And so when they get to the theater, we make them nice and comfortable on bed. When they are in the theater, we do another second check again with the anesthetics this time. When we confirm everything is done, we now need to set the patient ready for the surgery. Okay, what do we do to make them ready for the surgery? We get a cannula in. So basically most of them do not have cannulas. They don't have a cannula inserted from med rooms. We put them in the theater. So get a cannula. Mostly we use pink cannula or green because we really want to prepare for emergency. We don't want a blue cannula. A compression device, because we're trying to prevent blood clot during the time the patient will be numb. We put on a compression device for the patient, and when they have that on, we put the blood pressure cuff. So one thing I realized that is different on how they put their blood pressure cuff is they make sure that the blood pressure cuff is facing upward. So in the medical rooms, we put the cuff facing down, but they do put the cuff facing up. The oxygen probe on, and also get the ECG machine on to monitor the heart rate and all that. After you've gotten the patient all monitored and all the ops are fine, and we can give the anesthetic doctor a go ahead and say, okay, yes, the patient's ops are all stable and you're happy. Administer IV fluid. So we normally use Hartmann's. The anesthetic doctor then administers the pain reliever. So we normally use fentanyl as one of the strongest painkiller. We sedate the patient, the anesthesia, the patient goes to sleep. So basically you are pain free. You are not aware of the environment, you are sleeping, and the surgeons do what they need to do. Immediately we intubate the patient. Basically our work is almost done. I mean, aside the fact that we'll just be monitoring that the ops, the vital signs are all stable during the whole surgery. The next thing you do is to sit down at the head of the patient and wait for the surgeon to say they are done with the surgery. Then you extubate the patient, and that's it. I keep telling people that nursing is not that hard. You just need to look for the specialty that fits you, because in this UK, nursing in the ward, like regular ward, is hard, really hard. I mean, at every point in the theater, I had only one patient. I had maximum concentration. And this is not like I'm saying I'm remembering this one age, that one age, this one's condition, that one condition. It was just one patient at a time. Tell me, why won't I concentrate? And I feel like this is like one of the best specialties in nursing. I mean, I do not like theater nursing. No offense to theater nurses, I do not like it. I don't like the fact that I have to be passing instrument. Right from when I was in school, I never liked instruments. How can I remember what a Shitu forceps is? How can I remember what a couscous vagina speculum? I mean, all the instruments were killing me during school days, and I knew theater nursing was not for me. But anesthetic nursing, sounds interesting. Sounds like something I would love. You just stay by the head of the patient, ventilate the patient, make sure that the airway, I mean, your focus is airway. Make sure your airway is clear all the time at every point when you intubate and extubate, and then make the patient comfortable. It sounds like a soft work, but the thing is, you need to know how to communicate. If something is going wrong with your machine, if something is going wrong with the airway, open your mouth and talk. We had a case that was going to a minor emergency today, but the team was so fantastic. Everybody communicated perfectly fine, and were able to make the patient come back without even resuscitating or anything. Just proper communication. That's an amazing role. It gives you a sense of belonging to a team, if you know what I mean, and you are never alone. When I mean you're never alone, you are never alone. You're always working with someone. You're always working as a team with one patient. You just chill till they are done with the surgery. So when they are like few minutes to the end of the surgery, they will then alert you, the anesthetic doctor, to let them know we are almost done, and then we prepare to extubate the patient. Now, extubating the patient is where you need to be very, very careful, because then they can have a block airways, or they can also just like aspirate. So we are more careful. Then some of them will need to be suctioned. Anesthesia is weaning off, and the patient is able to be aware of the immediate environment. Then we take out the airway and allow the patient to breathe in, and we put in oxygen just to let them breathe. During this period, they will be allowed to go either back to the recovery room. The med room nurses will now take over, and it just continues like that, and you get ready again for the next patient, and it goes on and on. What's the difference between working in the medical area and the surgical area? Well, for me, I feel like it's not so much of a routine, because as an anesthetic nurse, you're allowed to work in various areas, but it's still like you dealing with the patient's airway and making them intubate and extubate them, if you know what I mean. But still, you are seeing different cases. The theater, you can be in ICU, you can be in ED. Even in the theater, yes, you might have CS today. The next one, you might have a patient that needs knee replacement, repair of the body. But it's like you've seen different patients all the time. Another difference is the fact that communication is more with the medical team. With the patients, you communicate with them when you are preparing them for the surgery, and then after. You might not even communicate with them after, but mostly when you are preparing them. But during and after, it's very rare for you to communicate with the patient. And then no relative, you don't have you rarely communicate with relatives when you work in the theater, like anesthetic nurses in particular. We don't really communicate with the relatives. We don't have much business with the relative. But in the wards, you know what I mean, you are constantly communicating with the relatives, always updating them what's happening. With the documentation process is easy peasy. They just do the skin check, the cannula care plan, and if they need to put a catheter, and they do the checks of all the things they use for the procedure, and it's done. There's no drug charts as per how we have it in the ward. And there's trolley. I mean, they have their trolley, but it's not like the way we push it around with our medication around and all that. It was really a day I love, and I would definitely go back in a heartbeat. Okay, we just stay by the side of the patient, just at the head of the patient, and we do our thing. There was no much running around like we run around in the ward. Well, except there is going to be an emergency where the patient needs urgent care, and then we'll run around. But if everything goes well in the anesthetic room, you don't run around. Everything is calm and chilled. It just goes at a very slow pace. Anesthetic nurse has undergone training. Like they have the anesthetic nurse training program. They have a short course for anesthetic nurses. It's a 6 months course. So during these 6 months, you have training, you have your mentor, and you work under 2 mentors, and you also have your learning days in school. So you have your hospital. enrolls you in an anesthetic course in a university where they study at level 7 or level 6. After the 6 months, if you feel confident, you are able to work independently as an anesthetic nurse and progress further to band 6, band 7. But they are not allowed to give anesthesia, so they will prepare the patient pre, during and after, but they do not give anesthesia themselves. Whilst a nurse anesthetics are nurses who are certified to give anesthesia. So the difference is a nurse anesthetics can give anesthesia with the supervision of a consultant anesthetics. Do I see myself moving to anesthetic nursing? Well, the world is my oyster and I intend to keep moving and keep riding, keep trying new things and all. For now, I am still going to be in my cardiology unit. I only went there for the experience, which I love. And yeah, I feel like I should give you guys this information. Hopefully it helps you to decide if you actually love the anesthetic nurses role. Let me know in the comment section what you think about anesthetic nursing, or even specializing in nurse anesthetics here in the UK. Do you think it's worth it? Do you think it's kind of away from the bedside routine, like you know how nursing is in the wards? Do you think it's something that you will fancy doing in the future? Please let me know in the comment section. I would love to know as well. And I'll see you guys in my next video. Bye.